Let me move on to health care. That could be the biggest difference between you and the Democrats this year. Democrats say your tax credit plan will not come close to covering everyone, and it especially won't help people with pre-existing health conditions. Here was Elizabeth Edwards, wife of John Edwards.
The truth is, a health care policy that covers everything but cancer doesn't exactly do me a lot of good. And so, as I said, John McCain and I have something in common. Neither one of us would be covered by his health care policy.
Now, she went on to say that both of you are going to be fine because you have plenty of resources to pay for health insurance, but for millions of Americans with pre-existing conditions, they won't. Why not guarantee that anyone with a pre-existing condition should be able to get health care?
We would, as part of our plan, have a special Medicaid trust fund set up to help take care for those people who are have pre-existing conditions. As you know, 5 chronic diseases consume 75% of the health care costs in America. We're not leaving anybody behind, but what we're not doing is we're not going to have a big government takeover and mandates. They've tried that in other countries. Both of the Senator Obama and Senator Clinton's plans are big government solutions. But that's true in everything that they propose, and we will continue to have this debate. What's wrong with it? Go to Canada. Go to England, and you can find out what's wrong with it. Governments don't make the right decisions. Families make the right decisions.
One of the points that Mrs. Edwards made in the Wall Street Journal, she said that your whole life you've had government health care. You're the son of a naval officer, now a member of Congress. And her point is, why shouldn't every American be able to get the kind of health care that members of Congress get or members of the military get?
It's a cheap shot, but I did have a period of time where I didn't have very good government health care. I had it from another government. So, look, I know what it's like in America not to have health care. We know that Americans are hurting there as well. We've got to make health care affordable and available. The difference, again, between myself and the Democrats, and in all respect, due respect, Mrs. Edwards, I want the families to make the choices. They want the government to make the choices. That's a fundamental difference, and we will continue to debate that issue. But we can provide incentives. You mentioned that it's not enough, a $5,000 refundable tax credit for every family in America. It's a lot better than what they got today. And if we can let them go across state lines and get these inflationary aspects of health care under control, which we can do, then more Americans will have affordable and available health care.